right, now, patients who depend on the national insurance to cater for their hospital bills will be forced to pay cash or stay without treatment after Health Cabinet Secretary Susan Nakumicha revealed that the government was too broke to remit money to the National Health Insurance Fund, NHIF, and it had a lot of people very angry on Twitter. But I will say this though, it has come through for me before. I was even telling Cindy this as well. It's come through for me before, a couple of times. But it's very unfortunate that so many people are going to be left out in the cold. If you go to hospitals, you see how many people are just lining up. They do need to use their NHIF card, and if it has nothing, well, they have to, go back home. It's so confusing, Mato.
So this is the same NHIF that lost a lot of money, and the culprits who were involved in the disappearance of the money are still at large. This is the same NHIF.
This is the same.
I'm just
NHIF,
confirming.
yeah.
Ah, okay.
Same
This is the same government crying that it does not have money, yet there was money that it was given, and the same government asking for more money so that it can lose and then say it cannot give us what we need to be given, like houses. This is the same.
It is the same, and this is the same health CS who says, oh, but you know, once the finance bill goes through, we'll be bailed out because salaried people are going to be charged up to 11,000 shillings statutory deduction for NHIF. Yet, if you are not a civil servant and you have that card and you present it at a hospital, you will not receive charges.
That is true.
This is so heartbreaking because I'm about the health scene and I've worked in the health sector before. When somebody has a disease like cancer, making it or not depends very highly on the money that they have. And it was really good for a while when NHIF would subsidize some of these treatments. You get 90,000 shillings out of 150,000 shilling bill for a mama mboga. That's a lifesaver. But now what is happening is, because they're not paying the private hospitals money, if you go for your treatment, your MRI, your CT scan, your blood work, you have to pay in cash. And it's very expensive. And you could say, oh, you know, you could go to government hospitals. The lines are long. Nobody has 2 months to wait for a result. So it's really heartbreaking. And I'm just hoping that the people who, are supporting this bill and what the likes understand the ripple effect that it's going to have in this economy. It's going to be Cindy, shameful.
And you know, the crazy thing is, the reason why I sometimes abhor politics is because every time you speak about something like this, then it almost starts sounding like you're supporting a certain side of a narrative. While the real place where you're standing is for the healthcare of the same people you campaigned to. The same people that you asked, because really NHIF is not about the mabwenyenye out there. It's about the mama bogas and the boda people you are talking about. And if you've ever used this fund, you know how much it comes.
It's about your grandmother.
And exactly. And the moment sahi sasa tunasikia tena pesa ya wazee haitoki, NHIF ndio hii inaleta shida, like the whole ecosystem of wazee nyumbani is good. I don't know.
Pesa ya walimu iko wapi?
This is the thing. And now eventually what's going to happen is, the moment institutions of healthcare start distrusting the insurance ya NHIF, they will not take it, especially the private ones. And it's never about going to the government hospital. Sometimes you get an emergency and the nearest institution is a private one. So you need to get admitted there, haraka haraka wakusaidie ndio uweze kumove. But now if you say you have NHIF, they'll be like, hiyo hauna insurance.
It's called Nikiweka Biblia Chini and Other Stories.
You asked where's the money. I saw that story about the government installing CCTV cameras in
the forest.
Yeah, for 3.2 billion. To detect early fires, so there's that. I'm just trying to help.
Priorities,
you
like it's
I'm trying to help you guys.
Priorities.
That's why sometimes
we've got what? You even
the juxtaposition in this country is strange. That the same country where you're hearing the same stories kama hizi, ndio unasikia ati sijui appointment gani imemekiwa ya watu wangapi, sijui wanaenda wapi, tutafanya, I don't know. I don't know how the government works. Maybe I will be domed.
Yeah. He's just saying that until at a state house. But let me tell you.